Now is the time for most of us to roll up our sleeves, gather documents, and pick a health insurance plan for 2020. It's open enrollment season. Chris Clackham joins us now with the details.
Whether you get health insurance through your employer, Medicare, Medicaid, or a private plan, it's time to decide what, if anything, you want to change for next year.
Every open enrollment period is an opportunity to evaluate both your financial and your healthcare goals.
For those buying individual policies on state exchanges, for example, the news is good.
Premiums are lower. We actually have new quality ratings for the plans, and there's more choices of plans.
The majority of Americans, though, don't buy their own health insurance. Most get it through their employer, and most policies have stabilized in price.
Don't skimp on saving for your health, because if something unfortunate does happen and then it impacts your financial goals.
Pay particular attention to deductibles and copays, and if shopping for a Medicare supplemental plan, ask other recipients for help.
Buy a plan according to your doctor takes it, the prices, the network. Make sure you analyze, don't just assume.
Don't let the process make you sick. Health insurance can be tricky, even for the experts.
End dates for healthcare enrollment tend to vary depending on your plan and carrier. An alarming medical mishap in Oklahoma. Police say 10 people were accidentally given a shot of insulin instead of the flu vaccine. Bartlesville police say they got a call last night about an unresponsive person, but when they arrived on scene, that wasn't the case. Multiple patients at Jacqueline House needed help. That's a facility for people with intellectual disabilities. Police say the scene was chaotic.
All these people are symptomatic, laying on the ground, needing to help, but can't communicate what they need.
Investigators say a pharmacist of 40 years was contracted to give the patients flu shots, but somehow the syringes were filled with insulin. Fortunately, everyone is okay, but the patients will have to stay at the hospital for a few days. Police are looking into what caused the mistake. You've probably heard the phrase, happy wife, happy life. Well, a new study suggests that it should be happy family, happy life. Researchers looked at survey data from nearly 3,000 adults. They found people who had a strained relationship with family members were more likely to be in worse health 10 years later. However, romantic relationships had no significant effects on health. Scientists think this may be because people can break up with their partners but tend to have a deeper bond with their family.